us. Can you confirm that this is a case of Zika virus here in South Africa?
Good evening, Robashni. Good evening to the listeners. Yes, I can confirm, but it will be wrong to say it's the first case of Zika virus in South Africa, because this is a visiting Colombian businessman who got infected in his own country, and only that he was diagnosed here in South Africa. I think it will be fair for us to say we have got the first case of confirmed Zika in South Africa if that infection takes place here on our soil to a South African. But I am confirming that there's a Colombian man who was diagnosed for Zika by a Johannesburg private pathology laboratory. At the moment, the National Institute of Communicable Disease is doing a confirmatory test.
Minister, where is this patient now?
Well, I'm not sure whether he's still in the country or has gone back home, but he was fully recovered, by the way. In other words, he's a fully recovered person, is normal. So he may either still be in South Africa or he might be gone back home.
Can you tell us more about his case? How was the virus detected?
Well, 4 days after his arrival in South Africa, he developed rash and fever and went to see a doctor who referred him to a private pathology laboratory. And the private pathology laboratory did diagnose Zika, and then they phoned and informed the National Institute of Communicable Diseases. That's why the National Institute is now doing a confirmatory test.
Minister, I'm just reiterating what you said. This is a Colombian businessman who didn't, in fact, contract the disease here. He was basically visiting here and he's since probably left the country. So I'm wondering, how worried should South Africans be about this?
Well, we're not really undue worried, Robashni, because Zika virus does not move from one person to the other. In other words, it's not transmitted from one human being to another human being. There has to be a mosquito vector in between. Now, for this Colombian man to infect a South African, it means a correct subtype of an Aedes aegypti mosquito was supposed to have bitten him during the 7 days when he was fully infected, and then that same mosquito goes to bite a South African. That is then how the disease will have been transmitted. But now we happen to know, Robashni, that the same mosquito, the subtype of Aedes aegypti mosquito that transmits Zika virus, is the same type that transmits yellow fever and dengue fever, which we don't have in our country. So we don't regard ourselves to be having a subtype of an Aedes aegypti mosquito that can transmit Zika, and that's why we are so comfortable. Remember that there was only one case reported in the United States of sexual transmission, and so it's still regarded by scientists as something that is very rare. Now, for that reason, we don't think we should really get unduly worried.
Minister, do we know after treatment, does the virus leave the body completely?
Well, because of this case in America, they believe people must, if they have to have sex, they must use a condom for about 2 weeks. That is just that particular case, and it's still something that is developing among scientists. But to all intents and purposes, for the cases that are transmitted by mosquito, like in the case of this man, after they recover, there is no more problem. Because as I said, the mosquito stays in the bloodstream for a short period of only about 7 days. And that person has to be bitten by a mosquito within that period of 7 days. Beyond that, it's no longer transmitted.
Minister Motsoaledi, what about other parts of our continent? Is there concern in other parts of the continent about Zika?
Not that I know of. Remember, the Zika virus was first diagnosed in Uganda in 1947. In 1947. So it's a disease that originated here in South Africa, but the present one that is in South America, we have not yet heard about a country on the continent that has got it directly from that area.
Also, Minister, if Zika had to reach our shores, and that's a big if. Would the South African Health Department be equipped to deal with such an outbreak?
Yes, we think so, because we have already started. For instance, when planes leave South America, because that's one of the ways. In other words, we believe the only way for Zika to come to South Africa is probably if the mosquito itself is imported into our country. But before, that's why when planes leave South America, they get sprayed. There's a chemical, special chemical, which we spray all the planes so that we make sure that the mosquito from that area does not come to our shores. We are doing the same thing at the harbors, for instance, with cargo that comes from such countries into South Africa. So we are really ready and vigilant for anything that might happen.
Is your department continuing to advise pregnant women from South Africa not to travel to South America?
All the better, all the better. We are actually advising them so. We are even writing a letter to the Minister of Sport to give advice to those who might be going there for Olympics. All the better, because remember, Zika virus itself doesn't kill. Nobody ever died of Zika. It's not like Ebola. The biggest danger is in a pregnant woman, where it might be transmitted to the fetus and cause malformations like microcephaly.
So, Minister Motsoaledi, bottom line, South Africans need not fear for now.
Well, for now, we really need not fear. We just have to be vigilant and take precautions. For instance, if people happen to go to South America or any one of the places with mosquitoes, they must make sure that they take care that they are not bitten by a mosquito by using mosquito repellent chemicals and creams, by making sure that they sleep under mosquito nets. In other words, take all the precautions that they are not bitten by mosquitoes. If we are vigilant, we take those precautions, we definitely have got no reason to get worried.
Dr. Aaron Motsoaledi, thank you very much for your time and for providing insight and clarity into that report about a Colombian businessman who was visiting South Africa and he had the Zika virus. He's now completely cured of the virus. The minister basically saying no need for South Africans to panic. We'll be back with more news on SABC after this.